But here's the funny thing, the number I put may not even be covered by your insurance.
Was born out of the idea of having aftercare for the patients when they come to the ER.
If you're uninsured or even if you have insurance, you may have resources, you may not. It's guaranteed that if I tell you as an ER doctor, I'm going to take care of you, you need to follow up with a GI doctor or you need to follow up with this resource. You're going to leave and you're going to say, what did he say again? What am I supposed to do?
Yeah.
And also, how the heck am I going to do that? Right? I mean, I don't even know who to call or where to go. And so I think we have an assumption that patients are going to take care of themselves. And if they don't, it's because they don't want to or they're lazy.
Yeah.
And the reality is it is a very complex, convoluted system. But
Yeah.
you got a lot of stuff you got to do to take care of
Yeah.
yourself, man. You got to call somebody or you need somebody to call you. And we assume that's going to happen. And guess what? It doesn't. But here's the funny thing. The number I put may not even be covered by your insurance. Maybe somebody that's 30 miles from your house and you don't have a car. There's so many factors that provide barriers to care. And you see that. And what's funny, there's an effect that I love. It's called the Dunning-Kruger effect or principle. And it's the thought that the less you know, the more confident you are about what you know. Just waited 3 hours in the ER and you're like, wow, that person's really stupid. Or that person is just lazy or, go figure it out for yourself. And you realize, well, that is the Dunning-Kruger principle. I don't understand all the barriers that prevent that person from really being able to access care. And that's so Telescope Health was born out of, and we'll get back to that because we have been solving that problem in Jacksonville, which is cool. And we're now expanding that to multiple other municipalities and cities across the country. But what's really neat is, we were born out of that concept that, okay, you can't just provide a physician visit, okay? So we built a multidisciplinary care navigation team around the physician visits. And then we built an analytics company around and division around the whole company so that we could say, hey, instead of waiting for people to come to us, we're going to partner with a health system or an insurance company or an employer or a city and say, why don't you give us the data on all the people that use the ER? And we're going to positively or proactively outreach those people. And why don't you give us the people who have these top 5 disease conditions? We're going to risk stratify that population. Then we're going to outreach those people. And we're going to have a team that knows how to call and text and talk to people on a human level. We're going to get them seen immediately. And then we're going to funnel them back out to all the cool resources that already exist in the community that you should have known about,
Yeah.
but you didn't because you're busy and you're a person. You got a life. And so that's the full spectrum of the soup to nuts care.